Yes, there are enormous amount of technological advancement. There is no doubt about it. Of course, that has a big shift to the patient as well as to the clinicians. Previously, the healthcare was basically doctor-based, how you examined, etc. Very few investigations, very little use of the technology, etc. and all that. Whereas today the technology is advanced so much, I can't even imagine. This is something, it is sometimes mind-boggling. And I can tell you that it is of a great benefit as far as the patient is concerned, and also to the clinicians also, because you are able to diagnose a patient much more accurately and also much faster. So the benefit will be passed on to the patient. Okay. So there is a little downside of it to some extent. That is, for example, doctor-patient relationship is getting affected. The clinical practice is not as it used to be. And the third thing is that to some extent cost of medical treatment has gone up like anything. Okay, that is something. These are the, I would say, what has happened over the years. See, I will tell you one of the challenges of as far as Indian healthcare is concerned, that we have imported the technology from all over, especially globalization. Anything that becomes a technological advancement immediately comes to India also, and many people are able to get it. And as a result, but at the same time, to make it accessible to all the population is itself a big challenge. Because number one, the cost involved in establishing them. Number two, one of the great advantages of Indian is we have got extremely good healthcare professionals, both doctors, nurses, technicians, etc. They are able to do it. But the main concern comes in as far as the accessibility to the large population. What you rightly said, that is something, that is why there is unequal distribution. But at the same time, in case of a healthcare, for example, if I can't afford, I won't travel by air. But that doesn't happen as far as the healthcare is concerned. If it is my health, so naturally that I would like to take whatever is best possible to restore my health. So that actually creates, and if I am not able to do that, so there is a great amount of dissatisfaction and also some kind of an anxiety, tension, conflict in the society itself. And also there is negative about the doctors and the hospitals, etc. So that's one of the challenges as far as we must meet it, and then we should say that how best we can how to face this challenge. Remote management is extremely important, okay, because as I said, it is not possible to send all technology skilled people to every nook and corner of our country. Rural areas, even in our own some small areas, etc., healthcare is not accessible the way it should be. So when this remote technology is there, you will be able to solve this problem to a large extent. So it has got a great opportunity, and I am very sure that actually it will be able to solve many of our current problems to the extent. See, government has got good intentions and also it makes good announcements, but actually implementation should be, of course it has done its best to the possible, but what is needed is much more than what actually is happening. And that is another thing for the government itself. Of course there may be a budgetary restrictions, etc. and all that, because that is one of the real problem. The healthcare budgetary by most of the Indian governments is much less than compared to any other people. So it's only 1.8% of the GDP compared to the 17% that is there in USA. Of course, we can't go to USA and you can't say that's the best possible thing. But at the same time, the government should actually allocate more resources. When I say more resources, in respect of all, technology, people, training, and also see that it is evenly distributed. So to a large extent, our health problems will be much more addressed, right? Yes, the challenge is there. We have progressed substantially, no doubt about it, but there is a long way to go. So for that, it is the responsibility of every stakeholders to do his or her best. Okay. Thank you very much. Okay.